Welcome back, everyone, to the podcast where we uncover the stories behind thriving businesses and bring you expert insights straight from the source. I'm your host, DDA, and in today's episode, I'm speaking with Bianca Carroll. She's a nurse practitioner who owns New Gen Direct Primary Care. Good morning, Bianca. How you doing?
Good morning. I'm doing well. And how about you?
I'm doing awesome. Thanks for asking as well. Well, before we get into this, listeners, I just kind of want to let you know from behind the scene experiences to valuable advice, this podcast is your go to resource for learning about businesses that shape our communities and discovering how to make the most of their services. And if you do like this content, you enjoy these type of videos, educational videos, please feel free to like and subscribe to the channel as well. Hit that subscribe button in the video and you'll be alerted of any new videos that come along. But with that being said, let's dive right in. Let's get to know Bianca a little bit. And Bianca, if you could share with our listeners a little bit about your background.
Yes. So I actually, I'm a board certified nurse practitioner with the AANP. I just actually received my 10-year certification. So I feel a little old, although I'm
Congratulations.
just 35.
No, that's that
um,
you gotta congratulate yourself on that. That's awesome.
yeah, it was like a shocking moment. I'm like, wow, 10 years in the game. But before that, of course, I was an RN. You have to be an RN before you become a nurse practitioner. So I worked about 2 years in ICU step down areas, particularly in cardiac. So heart health is my baby. And I did that while I was in school getting my master's. I also did a travel assignment to St. Croix, the U.S. Virgin Islands. My
That must
last
have
clinical
been
rotation,
that must have been nice.
that was amazing. That was amazing. I still have some very good friends there that I visit. I try to every year, but COVID stopped that a little bit. But I get to go back and see them. And then I jumped right into nurse practitioner in the primary care role. So all I've done has been primary care. And it is literally like walking into a ER at a slower pace. There's a different complaint, concern in every room. And I love that because it keeps it exciting.
Interesting. And coming from ER with your experience, and you said you dealt with a lot of cardiac, correct? Can you
Yes.
explain a little bit about that, for our listeners, if you don't mind?
Yes. So with my nursing background in cardiac ICU, those were patients that had just had a open heart surgery or a cardiac, what they call a cardiac cath. And that is where a cardiac interventionalist will go in to see if there's a blockage or what is causing somebody to have continual cardiac symptoms, whether it's chest pain or headaches and things like that, that may be due to a heart issue. So those patients were critical coming out of surgery. We would have to, get them stabilized and take care of them. And so you had to know about the heart, the different medications, different arrhythmias or irregular heartbeats, things like that.
So there's so much to the heart than just it pumping blood, correct?
Yes.
Interesting. In your business that you have now, and congratulations on that,
Thank you.
you there's many services that you provide, and some of the things that stand out was cellular. For our listeners, was the cellulite, the stretch mark, the scars, the excessive sweating. Can you elaborate on a few of those different types of services that you provide? Let's talk about how does a listener know they have it? Of course, some of these things are visual.
Right.
Is diet part of that? And what are the remedies to help our listeners maybe try to, work things on themselves, or better yet, contact a professional like yourself?
Absolutely. So my new Gen Direct Primary Care recently rebranded from another name last fall and added some medical aesthetic services. I was finding in primary care that a lot of these issues people don't want to go to multiple places for. So you would have to refer to a dermatologist or an endocrinologist to figure out why they are sweating so bad and things like that. And I found a medical device that treats a lot of these issues. So with the concern of stretch marks, I do a weight loss program. So when you shrink something or lose weight, you obviously have a mark from that concern. You have loose skin, you have cellulite where there's been a loss of fat. So I said, if I'm getting patients to lose weight and feel better about themselves internally, then they have all of these leftover physical issues. What am I going to do about that?
Mm-hmm.
Because then falls into, okay, I've lost all this weight, but now I still look bad, or I feel like I look bad. So I had to come up with a remedy for that, which was this device that treats those things. So of course, like you said, some of these are visible, the stretch marks, the cellulite, even scars. If someone has had a C-section or some type of surgery, mastectomies are getting really popular to get rid of those scars. There's a device that we use to rebuild that collagen and elastin that's been taken during that procedure, and it helps to get rid of the scar. Basically, it does that for the cellulite as well, because there's a loss of fat, there's a loss of protein and hydration there. So we do a minimally invasive procedure to bring all of that back healing, and it eliminates the cellulite, the stretch marks, and the scars. What happens with the excessive sweating or hyperhidrosis? Sometimes it's a hormone imbalance, so we check for that here as well. But sometimes people just overproduce; they have very large sweat glands. So the procedure that we do helps to decrease the size of those sweat glands. Therefore, it treats the excessive sweating. So there's very little downtime, if any. We call it social downtime because you may not want to go out with a little bit of redness. But other than that, it's a in-office procedure. It takes less than an hour, and then you can still go to work, go be with your family, and enjoy the rest of your day and have these issues resolved in about 6 months.
Wow, well stated. And by providing all these different services, I'm assuming, like you mentioned, the equipment that you have has technology over time help remedy or help make the process quicker for customers to get
Absolutely.
better. Okay,
Absolutely. That is a new trend, I will say. But and really in all areas of business, but in healthcare in particular, they are really leaning on technology for, like I said, less downtime. People don't want to have to go to a plastic surgeon to fix these things when it can be
Right.
done in an office setting, outpatient, and have way less downtime. So you're not missing work, you're not missing time away from the things that you enjoy.
And on another subject or another topic, what was that aha moment that said, you know what, I'm going to go from becoming a nurse? Of course, you became a nurse practitioner. Then you said this, saw a light bulb must have clicked on or went off and said, hey, I'm looking to start my own business. What was that aha moment that transitioned you from that?
It was actually a goal of mine to have my own practice at some point. I didn't know when, but I knew that in the previous settings that I was working with insurance, and I don't want to bash insurance, but there are certain ways that you have to treat patients and a certain amount of patients you need to see to receive payment. And I felt like I was doing my patients a disservice by doing that. So I knew I wanted to establish my own practice and do things my way where I felt like I was really helping. And it kind of like it was going back and forth in my head, like, is now a good time? I don't know. Like, I know nothing about business. I'm strictly medical. And I am very much, you can ask my parents, my family, I'm all in or I'm all out. So I went all in and here we are.
No, that's good. And what you said is now a good time, right? And we have a lot
Right.
of people who are listening that listen to this channel that are business owner or are aspiring to be business owners, and that topic keeps coming up. Is
Mm-hmm.
now a good time? There's never a good time
There's never a good time.
in anything, right? You just have to jump in and learn the process as you go. And over
Yes.
time, correct? Over time, you'll start to see the light at the end of the tunnel, which
Yes.
is what you have done in terms of accomplished with your business right now. So there is actually, I was kind of thinking, you also do facials as well in terms of the glowing skin. Let's talk a little bit about that, and then I'd like for you to kind of share a story of a customer. Don't mention their names,
Yes.
of something that you really, the light went on and said, wow, this customer is happy, or the feedback that you got. So let's start with the facial first, the glowing skin.
Yes. So with the aesthetic procedures that I recently added to the practice, there are more medical procedures, so they have to be done by a licensed professional. But a lot of those patients that have come either for a model service or that we practiced our training on were asking, well, do you do facials here? And I thought, well, what better place to add in facials as well? So we brought in an esthetician, and she does our facial services, from the basic facial exfoliation, dermaplaning, and also does back facials, because a lot of teenage hormone teenagers have back acne, and even older adults. So we added that service in. And to give you a story of a client, actually is a colleague of mine, I'm finding a niche with other healthcare professionals and business owners who don't have time for themselves, is what I'm niching down to. And it's really weird. But another colleague of mine who was a nurse practitioner had suffered from really bad cystic acne, brought her in and did a microneedling treatment. Those are done every 4 weeks for a total of 3. After the first treatment, she noticed an improvement, but of course, you're not going to reach your goal till after those 3 treatments, we say. The second one, she noticed a little bit better. By the third one, she was sending me pictures like, I am walking by the mirror and don't even recognize myself. I'm smiling. My husband is like looking at me weird. And I'm like that made me feel so good. I'm actually getting one today on myself, which is why I have no makeup on. But we're doing a PRP microneedling session today on me. So I will be recording that. But just the difference, you never know how you're going to make somebody feel in their own skin with a simple treatment. So that has made me feel better than anything I've done in primary care.
And that's awesome, because I usually ask, when you tell a story, then I come back and I say, how does that make you feel? And you just answered it. Yeah. You actually, you're so excited to see your patient excited, which makes you excited as well. So that's awesome. As we wrap up here, could you provide a phone number as well as a website for listeners that may want to get a hold of you?
Yes. So our office phone number is 407-904-0942. And our office website is www.newgen.com. So no spaces, all lowercase, NEWGEN,
Well, thank you so much, Bianca, for, taking time out of your busy schedule to share your business, your successful business, and we wish you much success as well.
Thank you so much for having me.
You're very welcome.
Thank you for tuning in to First Media Consulting Podcast. If you enjoyed the podcast, subscribe today. To nominate a business you would like to recommend to be on our show, go to firstmediaconsulting.com or call. Thank you for listening.